So in today's video, we're going to be discussing ovulation. If you know somebody that doesn't know how to calculate ovulation and they've been trying so hard to figure it out, invite them. Let's educate each other. Okay? Let's get into it. Okay, so for you to understand how to calculate your ovulation very well, you have to understand what ovulation really is. What happens when a woman is ovulating? Well, this is where an egg gets released from one of your ovaries into your fallopian tube. When that egg is inside that tube, it gets ready for fertilization. If a sperm comes to fertilize it, you will get pregnant. But if it does not get fertilized, it is going to shed and you're going to see your period. That is my simplest understanding of what ovulation is. So now that you know what it is, how do you calculate it? Before you know how to calculate it again, you have to figure out what signs you have. What does your body tell you at that particular time? For some people, they have pain on the left side or on the left side. Some people have pain on the right side, depending on where the egg is getting released. If you have pain on the left side, which means that the egg on the left side is the one that is getting released, hence the pain. Same way, if you're having pain on the right side, the egg on the right is getting released. So if you feel pain on either side at that time of ovulation, it is normal. Don't think of it as, okay, I'm not feeling well, or maybe it is not normal, or whatever, you get worried. No, that is very normal. One sign. That's one of the signs I actually have. Secondly, your cervical mucus, how is it? Is it stretchy? You know, that egg whites, you know, it looks like egg white consistency and everything like that. Then that's a sign that ovulation is about to occur, or it's actually occurring. You understand me? If you don't see all these signs, you know, some people don't see signs, they don't see all these things, but then you don't have to worry. You can still ovulate without seeing all these, without having side pain. Okay, your mucus, it cannot be as stretchy, but then it can be thin enough for the sperm to be able to slide in very well. So if you don't know how to see all these signs that come along, this is where testing comes about. Okay, you can get what is known as an ovulation predictor kit. This is what I use. These are the two methods I use in case I don't see all those things. I have an app. I usually use Flow. I have always used Flow because it's always been accurate for me. It might not be accurate for you, but it's always been accurate for me. I use Flow, but because I know Flow will give me details of, you know, it will just give me feedback of what I already entered inside it. Okay, so how do I back it up? How do I know that this Flow is actually giving me the right thing? It is actually giving me the thing that I need. I buy an ovulation predictor kit. Okay, the ovulation predictor kit has sticks inside. Those sticks look exactly like pregnancy, you know all those pregnancy test kits. They look exactly the same, only that this time they're not checking for the HCG hormone, they're checking for the LH, the luteinizing hormone. The luteinizing hormone is the hormone that shows you that you're ovulating. Okay, if you test for ovulation using that stick, it's going to give you, there's a control line and there's a test line. The control line and the test line have to be the same color. the control line has to be as dark as the test line has to be as dark as the control line, or even darker than the control line. Then ovulation is about to occur. It is not occurring. It's about to happen. What happens inside is that if it shows you that, okay, these two things are as dark as each other, it shows you that your luteinizing hormone has gone up. It has gone up. So if it goes up, it means you're going to be ovulating in the next 24 hours. Not at that time that it has gone up. That one is just giving you a sign that, okay, this thing is about to happen. It is not happening. It is about to happen. So when you get a positive on ovulation, it means tomorrow you're going to ovulate. Okay? Sometimes you can actually, some people don't really check before they ovulate. They want to check on the day they're ovulating. This is why if you test on that day you're ovulating, you might get a negative and you think, oh, I'm not ovulating. Why? Because you didn't check on time. This is why it's important to get, if you buy that entire box, you'll find maybe there are 5. Some people buy 2 boxes, some people buy 5, some people even have 100 test kits, sticks, just to be sure. Do you know when they start testing? As soon as they finish their period, every day, until they see that, okay, it has finally changed, the color has finally changed, every day at the same time. One thing that you're supposed to keep in mind is that you cannot test for ovulation with the first urine. You can't test your ovulation in the morning. You can't test for ovulation at 12. The best time to test for ovulation is from 4 p.m. between 4 p.m. and 10 p.m. Those times, between those times, you have to pick one particular hour. It can be at 8 p.m. You'll be testing at 8 p.m. every day until you get a positive on your ovulation. You understand me? If you get a positive on your ovulation, then you will know, okay, I'm ovulating tomorrow. I hope you understand how to use the app and the OPK. Some people use their body temperature. For me, what I used to do before I learned how to use the OPK and everything on the app, I used to check my temperature. I used to get extremely warm in my hands, in my palm, extremely warm when I'm close to my ovulation. I don't know if it happens for you, but it used to happen to me. So for me, the way I know that I'm actually ovulating is my palm will get extremely warm. I'm going to have pain. It's usually on my left side. I'm going to have pain, and I'm going to have stretchy mucus. That's how I know. So how well do you know your body? How well can you calculate your ovulation? And then there's also a thing about cycle length and ovulation. Cycle length, some people get confused. Let's not make the video too long so that you fail to understand. So we're going to talk about the next topic. We're still going to talk about ovulation so that you understand it very well. But this time I'll tell you how to calculate using your cycle length. Because people have different cycle lengths. You understand me? My cycle length and your cycle length will not be the same. Some people have 26 days. Some people have 30 days. Some people have 33 days. Some people have 21 days. You understand me? It is different for a lot of people. So we see periods. We see our ovulation at different times. This is why I mentioned that if you're using an OPK, start testing as soon as you finish your period. That way, it's easier for you to pinpoint when exactly you're going to ovulate. That is it for today, guys. I hope this one gets to you in good health, and I'll see you guys in tomorrow's video. Bye bye.